The importance of an isometric quad set is to help retrain and regain strength in the quadricep muscles.
For an isometric quad set, you're going to have the patient lie on their back. They're going to straighten the leg and tighten their quadricep muscles and make a contraction. Holding it for 5 seconds, pushing the knee flat to the table. The patient should perform 3 sets of this exercise 10 times. The importance of ankle pumps is to push away all the swelling that may be present after surgery.
For the next exercise, we're going to be performing ankle pumps. What you're going to want to do is instruct the athlete to push their toes down to the floor and hold it, and then raise up all the way toes to your nose. You're going to want to perform this about 10 times for 10 sets, and it helps to circulate blood throughout the With ankle pumps, you're going to want to instruct the athlete to reach maximal dorsiflexion and maximal plantar flexion.
The next exercise is active assisted knee flexion. You're going to instruct the patient to put the bad leg on top of the good leg. You're going to instruct them to slowly move their leg into full extension and slowly bring it back down, not exceeding 45 degrees of flexion. You're going to instruct the patient to perform 3 sets of this exercise 5 times. In phase 2, we're going to repeat some of the same exercises: isometric quad sets, ankle pumps, and seated active assistive knee deflection.
The importance of heel slides is to help regain flexion range of motion within the knee. You're going to want to instruct the athlete to do 3 sets of 8. For the next exercise, we're going to be doing heel slides. It's a range of motion exercise to help increase range of motion and flexion in the knee. You're going to have the patient lie down on their back, have them come up. You're going to place a towel underneath their foot. You're going to have the patient slowly bring their knee up, flex and bring their knee up until they feel it stretched. You do not want them to exceed 45 degrees within the flexion.
The next exercise is hip abduction. You're going to want to have the patient lay on the uninvolved side. You're going to have them extend both legs, and they're going to contract the quad while slowly bringing the leg up, but do not exceed 45 degrees of abduction. And back down. You're going to instruct the patient to do 3 sets by 8.
The next exercise is toe raises. To perform this, you're going to want to perform it with the knee immobilizer on. You're going to want to instruct the athlete to lean on the table or chair for support. You are going to tell them to tighten their quad to keep the knee straight and to raise up on their tippy toes all the way, hold at the top, and then slowly come back down. You are going to want to instruct the athlete to do sets of 3 and by 10. The modalities were ice and electrical stimulation. The placement for the pads are 2 under the patella and 2 on the quadriceps. You're then going to plug them in. And apply the ice. You want to make sure that the channels are crossing. Parameters are a 20-minute duration time and an intensity of what the athlete can tolerate. In order to keep your athlete in cardiovascular shape, you are going to want to use a cardiovascular machine such as the UBE arm bike.
The next exercise is active assisted knee flexion. You're going to instruct the patient to put their back leg on.
Go get Evan. Go get Evan.
I hate